All right, I think we'll start. So welcome everyone to this second in the series of webinars being co-hosted by the Reproductive Health Supplies Coalition and the MHM and Emergencies Working Group of UNICEF, UNHCR and UNFPA. And I am Nancy Muller. I am the co-chair of the RHSC Menstrual Health Supplies Workstream, along with Tanya Mahajan, who's on this call. And Adrian Dongas is representing the MHM and Emergencies Group. And Madison Shobin is with RHSC and has pulled this all together. So again, welcome. I'm so glad you can join. It's always exciting to talk about menstrual health and this area of menstrual waste management, which does not get a whole lot of attention. Even though menstrual health has gained increasing attention over the last 10 years or so, specific attention has really been directed mostly to the silence around menstruation, around trying to normalize menstruation, and also around products and sanitation systems. But the recent report from RHSC looking at commodity gap in various areas included menstrual supplies for the first time. And it estimated there to be 1.67 billion menstruators worldwide in low and middle income countries. And the good news is that there's a significant increase in the use of menstrual products worldwide compared to any information we had before. And even though this is a really positive change and we do want to celebrate that, it's easy to miss the fact that there is a cost to this use of products, which largely lands in the disposable products category, products that are not compostable. So this area of disposable products, which dominate the market, results in this huge new waste stream that was previously pretty insignificant when products were cloth, reusable cloth that would degrade in the system. And the disposable products include plastic components and super absorbent polymers and blood and body fluid. So it's become apparent that there's a need to look into these issues more and to understand how this waste is being managed and what thought is being put into it. What are the issues that need to be considered? Addressing this issue is something that belongs in many sectors: environment, sexual reproductive health and rights, gender equity, WASH, humanitarian, and education. And this may seem like a diversion in this area of menstrual health, which doesn't get a lot of attention, but it's really important that this area that goes under-recognized is looked at before it becomes something that becomes another barrier in menstrual health and something held against menstruators because of the lack of systems for managing their waste. We're happy to have a chance to dive into this conversation today with several experts who are going to share their experience in research, in policy, related to the role of systemic stakeholders in menstrual waste management. And with that, I would just like to note that we're going to have a poll in addition to the one you filled in when you logged on. And this poll will ask you a couple of questions. One will be selecting the appropriate response of menstrual waste is an issue that I encounter in my work. And then you agree or disagree, and to which extent. And then the second question is, have you or your organization actively engaged in any work related to menstrual waste? Just so we can get a feel for what is happening with people in their sectors. So if you complete this, then we'll get a little a notice when the results are available. So this won't be up for very long. So if you could fill it in now, it would be great. And then we'll have a little bit of a picture of who's attending and what's being prioritized in terms of menstrual health. And with that, I would like to welcome our presenters. We have 3 presenters, and then we will have 3 panelists joining us. So there's a rich group of people here with a lot of experience in menstrual health and waste management. The first is Miles Elledge, who is the director of the Babson Center for Global Commerce at the University of the South. And he'll be sharing his perspectives on working on sanitation systems in low and middle income countries and how menstrual waste impacts these systems and those operating it. And the second presenter will be Robin Wilmoth, who is an environmental engineer currently working with Kennedy Jenks Consultants and has a history of working in menstrual waste management in various settings. She'll be presenting findings from a study done by PATH on the interaction of menstrual waste and sanitation systems in India and South Africa. And I will just note that I was also with PATH when this study was done and was leading that study, so that I have just to be clear about my involvement with that. And the third person is Dr. Shyamala Mani, who is the ex-National Institute of Urban Affairs of India, is with that group, and she will address key research questions while identifying areas of future investment in the issue. So with that, I would like to invite Miles Elledge to share his presentation with us. And we'll have a chance for questions later on, but please, if you have questions as the presentations are made, put them into the chat and we'll try to answer them directly or bring them into the conversation. Miles, go ahead.
Great, thank you, Nancy, for the introduction. And good day to all of you. Pleasure to be with you and talk about this important and often neglected topic of menstrual waste. I want to share some insights from my work. A lot of it has been looking at technology and technology change and how that relates to community behaviors, mostly in shared settings, mostly in urban environments, with a focus on a number of cities in India, 2 cities in South Africa, and also in Dakar, Senegal. If you go to the next slide. So I want to touch on 5 sort of topics and want to answer the question sort of why are we worried about menstrual waste? Why should we be taking a look at it within our both research and our programming, and to share some of my observations within this sector. So next slide. So first off, I want to touch on the topic of safety as it relates to systems, again, particularly in urban settings. And what we know is very little. There's limited research or epidemiological evidence on the risk of solid waste in emerging markets as it relates to menstrual waste streams. There is some evidence in some developed countries. For example, there's some work from a professor in Arizona, microbiologist in the United States that has looked at menstrual waste disposal bins. And he has identified in his research some area of concern with respect to disposal locations being a hotspot for a number of risk, bacterial risk, including E. coli, Hep A and C, staph, and also that these bacteria are somewhat hardy. They stay around for several days. So there is some risk to those that may be in and around or servicing those bins. I've also been associated with some laboratory research with a couple of universities around the world, and this also has confirmed the presence of E. coli on menstrual pad waste. And as a reference point, I look to the U.S. Occupational Safety and Health Administration, and they have some guidance around safe management of bloodborne products, and this includes menstrual products. And while this is not regulated or classified as medical waste in the United States, it does lead to this federal agency to setting some standards for how buildings and public restrooms should be managed. And it calls attention in particular to safe handling of menstrual waste streams, specifically around waste bins and the fact that they should be lined, and as they are emptied, that they should be regularly disinfected. So this guidance suggests, indeed there is some concern, there is some safety risk, perhaps within this waste stream, but it is indeed an area of limited public health understanding. Next slide, please. The second topic is around cultural factors, and this could be a discussion for several hours in and of itself. But I just want to highlight that there are tremendous set and variety of stigma and taboos associated with blood and blood-borne products, such as menstrual waste, including concerns or cultural sensitivities around who sees the waste, who may handle the waste, where it is disposed, how it might be disposed, concern around the types of treatment, and also concerns around blood being in black water and the potential for recycling black water. Another area is where you find sort of conflicting field observations, and that's this sense of beliefs very much influence disposal practices. So in some settings in our survey work, we found that people carry away the waste from a public space for fear of how it will be handled. And then you also find the opposite, and that public spaces are desirable for disposal, particularly in lower income or informal settlements where privacy is a major concern. So the public spaces are a safer place to dispose of than one's home environment. And sort of a takeaway from the survey work is very strong preferences for people would like to, users would like to have the opportunity to dispose in a public space, but only where there is privacy and there's confidence in how that waste will be handled. Next slide, please. So the third topic is around policy, and we have generally a lack of guidance on systems to manage menstrual waste at national, provincial, and local levels. And this issue is particularly important as you think about public spaces and public bathroom facilities, and it is typically the domain of local government, and many local government rules, regulations, guidance documents do not address how waste streams should be managed within these spaces. We also find in a number of countries institutional confusion between agencies working in education and the management of those facilities. So education ministries, local government agencies, and public work agencies in terms of oversight and consistency in practices of how shared facilities may be managed. We also see in a number of countries confusing or misleading guidance about what is menstrual waste. And I know Dr. Bani will speak to this in the India case. Solid waste is what it is often referred to, but in some cases it's labeled as regulated waste, so higher risk than solid waste. And in some countries, menstrual waste is actually classified as medical waste. And this has significant impact in terms of classification of behavior and drivers of behavior and the types of service provision one might have. And also you see a gap where you may have the waste identified as riskier, but then you don't have a really clear guidance on what one should do for managing the waste streams, and even less enforcement of potential guidance that may be there. And particularly on the treatment side, there's very little guidance or regulations in terms of facility oversight, in terms of preferred methods of treatment, guidance around burying or landfill practices, or on incineration. Next slide, please. So the fourth topic is looking at kind of the cost of poor waste management. What does it mean when it's not done well? Again, with this focus on shared and public spaces. So one is you have when waste treatment system, solid waste collection is not done well, you get undesirable facilities. So sites that are not clean or attractive for use. And this further is complicated by cultural taboos that may influence practices or preferences to use sites that are not well maintained. You'll also have issues of workforce safety and servicing. In many settings, cleaners are ill-equipped with PPE to safely manage and clean public and shared facilities. So these workers are often unprotected, and they may be exposed to some bacterial virus risk. And you may see them opting out of not cleaning for fear of the risks that they themselves may encounter in servicing. You also have an economic sort of cost of operations concern. So when facilities are clogged because waste from menstruation is getting flushed into the toilet facilities, often creates a clog, and then you have a toilet that goes out of service. And when WASH and many programming initiatives are trying to foster and encourage greater toilet use, this is a huge setback when a facility goes out of service. You also have a high cost of maintenance, and we have some anecdotal evidence from a number of cities in India in terms of the multi-million dollars that they are spending to declog clogged sewer lines and toilet facilities. And not all of the problem is linked back to menstrual waste, but is it a significant concern? And then you also have the infection risk associated with poor waste management practices. So when toilets are clogged and pipes are clogged, you have an operational risk of spill. And with those spills, you have a huge infection risk with black water. Next slide, please. The last topic I want to touch on is incineration. So incineration is one approach to waste treatment. It can be both large systems and decentralized systems, or small scale in toilet facilities. And there's some good here in that this approach can work, but there's a lot of discouraging or many challenges. One is that there are very few safety standards for small systems. Your large centralized systems for medical waste are highly regulated and are clear in their safety standards. But you do have some cities like Pune, India, trying a centralized collection of menstrual waste and then taking that to a larger facility. But then you don't have operational guidelines for those sort of medium scale systems. Also at the toilet level, where you have really small scale decentralized incinerators being installed, there are many challenges. And I can geek out on this because I've done a lot of work in the field. Happy to entertain questions. But some of the concerns are sort of poor design for users in terms of accessing the facility for disposal. Many of these systems are electric, so power supply is often interrupted or unreliable, which then creates a problem for the user in terms of untreated or unhandled waste. You also have systems that are very sort of poor in their construction, not very durable. A lot of the systems that are very common in Africa and South Asia operate at a very low temperature. And this is problematic for several reasons. One, you don't get destruction or disinfection of the waste product. And also burning at low temperature, you get some hazardous emissions. Another problem is the installation and venting of these systems. It can be done well, but in many cases you find venting is poorly done, or the exhaust systems go right back into where people may be gathering. And in general, there's an absence of product testing, inspection, or certification for this line of decentralized incineration products. So the good news is that there is some innovation happening. There are a number of organizations that have developed some prototypes and are now doing some testing in the field with new and improved small-scale systems. And these are proving to be durable. They come with better user design, automated controls. They address a critical sort of technical performance issue around temperature. So there's kind of a sweet spot between 400 and 600 C if one were to pursue incineration in terms of getting complete destruction and disinfection, but doing so with reduced emissions. And also these systems, partly because of that temperature, but also the design of built-in venting does perhaps suggest that it could be a useful and invaluable innovation. So I'll close there. Happy to talk further through the Q&A. Thank you very much.
Thank you so much, Miles. That was great, really great overview of these issues. And I know we'll be coming back. There are some questions that have come up around cost and the risk of blood and fluid waste. So we can come to those later during the Q&A. And I think Joseph will have some things to say about this also. So in the interest of time, we'll move on at the moment, but it was a great presentation. Thank you. Right now, also, we are going to do the results of the poll. So here you should be able to see that the people generally agree or strongly agree that menstrual waste is an issue that I encounter in my work. So 35% of us here strongly agree, and 59% agree, and 6% do not agree that it is encountered in their work. So that I think shows who's attending this webinar. That's interesting, though. It's encouraging that it's quite well represented in your work currently, those of you on this call. The second question, complete the following statement. Have you or your organization actively engaged in any work related to menstrual waste? And it looks like the largest response was yes, understanding menstruator practices, 47%. And then yes, technologies and solutions for menstrual waste management, 41%. And then impact on water and sanitation systems. So no was only a quarter said no. Everybody else has some experience with this. So that's also really encouraging. This is a rich group of resources we have here. That's great to know. And I know that there'll be questions as we go along. So thank you for responding to that. I'm now happy to introduce Robin Wilmoth, who is an engineer and who is going to be presenting on work that was done when she and I were both working at PATH on the Menstrual Management and Sanitation Systems project. So she's an environmental engineer, and we're very happy to have you, Robin. Please go ahead with your presentation.
Thank you. So yes, I'm an environmental engineer. I worked alongside both actually Nancy and Tanya, who are both on the call. And I am presently also continuing to be an environmental engineer working domestically in the United States, but continue to work on sanitation infrastructure. So in my day job now, I work on the design and construction of wastewater treatment facilities and also conveyance systems. I continue to work in the industry. So I do also, as Nancy pointed out, wanted to acknowledge that the research that I am presenting on is research under PATH, and we do have permission to share that research. Next slide. So the study was the Menstrual Management and Sanitation System project. The overall goal was to understand the extent to which menstrual hygiene management should be a consideration when planning sustainable sanitation systems for both the urban and the peri-urban core for the focal areas. And also of a keynote, the objectives were to understand, it was twofold, was how practices and products impact promising sanitation systems that serve low-income populations, but also how the systems themselves, in fact, affect the menstruating women who use them. Of note, when saying promising sanitation systems, was related to the focal areas of the funder, which is the Gates Foundation, and they were really emphasizing and continue to emphasize sustainable sanitation systems, more decentralized sanitation rather than large centralized. When you think of centralized systems, that would be a large, for example, a city that has piped networked plumbing that serves the entire city, and they would have a large municipal wastewater treatment facility. So that's when using the word centralized versus decentralized. Could be a single household. It could be a larger population, multiple households, or a kind of a community to a certain degree, quantity of people served by that sanitation system. So it's more of a smaller grouping that is served by that. So they were looking at a variety of aspects for. There were wet systems, which would be connected, for example, to like a decentralized wastewater system and some innovations on that side, but also dry systems that could include ecological sanitation or other methods of composting and various other innovative approaches to using biological systems to treat that waste. So with that, we had the case studies. Next slide. We had the case studies that were focused, as Nancy had noted, in South Africa, so in partnership with the University of KwaZulu-Natal in the eThekwini municipality, which is where Durban, South Africa is located. And then also the study was in the Tiruchirappalli, Tamil Nadu, India, also area in partnership with SCOPE, which is the Society for Community Organization and People's Education. And we were really focused on bringing, I'd like to say, as we talked about user-focused and system-focused research, is bringing voice. So with the users, these are menstruating women, and bringing their voice through a variety of qualitative methods. But then also the system focus was bringing voice to the variety of people who work on sanitation systems and or make decisions regarding sanitation systems. And so it could be everyone from the caretaker to the system operators up to people who are at the planning level, and they could be in the ministry, et cetera. And the methods included in-depth interviews, focus groups, discussions, direct observation, a lot of photography, and then also a method called photo voice research, which was actually a method of collecting stories by the women themselves. And so it was utilizing a variety of engagement with users and having them engage in group settings, but then also spending time where they captured their story through pictures themselves and were able to share this with us. So it's a very rich way of storytelling. Next slide. So with the key findings, and it does resonate also with what Miles was speaking of, was the importance of recognizing the social, cultural, religious messages and the taboos about menstruating, and really how those influence how women manage their menstruation, and in oftentimes and in isolation. The disposal methods, they do coincide with taboos, and they contribute to the decisions that we make of how to dispose. It could be burying, it could be burning, it could be dumping or disposing. And for example, also a desire to pre-wash or dispose of the blood that way. One of the study participants had said in particular, when our bloods are getting spilled, we will be bitten by shyness. And it's a very intimate and private aspect. And so one of the greatest risks to women's sense of privacy was in the discarding of menstrual waste, and really also not wanting for others, especially males, to see or interact with it, and the degree of effort that an individual would put into how she manages her menstrual waste. Next slide. Some of the really, feedback about how to dispose is without containment. For example, with waste bins, and in particular, if you're in a communal facility, is that without the ability to have the waste bin in the collection, then how it gets disposed of can ultimately result in blockages or damage to the sanitation systems. And then with the trending of using more disposable products, that in the disposal into the systems themselves could result in a likely increase in blockages. And then with high expense and also disuse of the sanitation systems, as Miles also mentioned about downtime in particular of those sanitation systems. So women users and then also facility caretakers where they exist, not all facilities have caretakers, but where they are caretakers, it would be very critical for them early on to be involved in the planning process for any promising sanitation or waste systems, to elicit their feedback and ensure that the proposed approach is appropriate, and that it would be used. And so that is a key element, is that engagement and partnership. Another key aspect is about the criticality between sanitation and solid waste management systems. And that was one of the discussion points in particular with the stakeholders. I recall about in Ita Queenie in particular, that there were two different units, and the two different units were not necessarily aware of all of the timing and the distribution and engagement within the areas that they served. And so there is, if you do have the management systems, how well are they coordinated? And then if you don't have the management systems, that then means that the solid waste management is handled much more at an individual and neighborhood level versus at the kind of higher service level, but that coordination is critical. Next slide. So ultimately, there were some key aspects about planning, and we've talked about kind of the anticipated increased volume and loading on sanitation or on the solid waste streams. Also talked about, and I believe that our next speaker will be talking about more about the guidelines, but really the roles and responsibilities across sanitation, as well as solid waste management departments, and then guidelines at national and then all the way down to local levels, in available budgets for whatever approaches are determined. Another key thing is about when thinking about what the disposal options are is really looking using kind of a methodology. We had drafted a methodology, a decision tree to map out about considerations of cultural, political, financial, and environmental constraints, because not every area is going to have the same constraints. And so kind of going through that to determine what would be an appropriate approach is a helpful tool for decision making and identifying acceptable disposable options. Next slide. Again, noting the inclusion of women in these decisions and any sort of proposals that occur. The picture on the left was noting it was in the Mussoorie district in India. That was an area where women walked down to the steps to be able to access the water to rinse their menstrual rags, and the cultural aspects of why they wanted to rinse is an important component of what would be an appropriate disposal option in having those conversations. And then the picture on the right shows some images of the limited number of solid waste containment that was that we encountered during our research. There weren't, in all of the facilities, the communal facilities, there weren't any individual containment bins in the stalls themselves. There was some containment by the Department of Solid Waste in the communities. However, it was intermittent, and most of the caretakers didn't actually even have the bags supplied by the solid waste division. Some brought them from their own homes or improvised. One of the key aspects about solid waste containment is it discreet? Is it secure from animals? For example, dogs are very, very likely to be attracted to menstrual blood. And so there was a lot of effort to try to avoid having animals getting into the solid waste bin because they are so attracted to it. So it could be hanging it. Some people hung the garbage bags like higher. However, in some of those examples shown there, they were on the ground, which made them more prone to being able for an animal to get into them. So securing is also a key aspect of that solid waste management. And then from a planning perspective, having female planners and having them to be able to interact with female users. Next slide.
Robin, I think you have about 1 minute left if you can.
Oh, okay. Oh my.
On what, yeah, the key takeaways, and then we'll come back hopefully during the questions if there's more.
Sure.
Thanks.
So on the disposal containers, there was already some discussion by Miles. So this was just showing some examples of on the left not having disposal available, and then on the right was an example incinerator. But he's already presented on that. Next slide. So really the importance of education and having that available for planners and also for users, really critical. Next slide. Protecting workers, this really resonates with what Miles was noting, and really having also the type of protective equipment that is dexterous. So the gloves were noted that they actually were really hard to use. So you would want dexterous, appropriately sized. You also want your equipment, for example, this woman's wearing, she used her own high boots because she, from a cultural perspective, needed to be able to wear skirts. And so the shoes that were provided were too low, so she needed high boots. And then the picture on the right also shows that in one of the facilities was in a religious area, and that they weren't allowed to wear shoes in the facility, which actually exposed the caretaker to whatever was on the ground. So again, the importance of really protecting workers is really critical, but also understanding cultural practices and some of the constraints in areas. Next slide. I really wanted to, a shout out to the Itaquinese municipalities pipe blockage teams. They really shared their experiences of clearing pipes and the challenges that they faced. Next slide. With those, the cost of those blockages were significant for the Itaquinese municipality that maintained a fleet of 58 blockage teams. They experienced about approximately $6 million US were spent on maintaining that fleet to remove blockages. That's an extensive amount of money, and that was in US dollars. This was the research report was in 2013, so it's almost 10 years ago. And so those costs of blockages are significant. So minimizing disposal into sanitation systems is a critical component. And also about the differences between pipe systems are more likely to have significant blockages versus dry sanitation systems. So there are different challenges that each sanitation system would be impacted by if someone disposed of a product in the sanitation system. Next slide. From a loading perspective, I did want to share, this was a table of the analysis of each of the menstrual hygiene products. A lifetime loading for the different products from an individual ranged from 0.1 to 190 kilograms per person per lifetime. And to put that in and that kind of shows the difference of the types of products, whether it's reusable versus disposable. And for comparison, in the US, the average municipal solid waste disposal for an individual is 2.2 kilograms per person per day. And so that provides some perspective about the amount of waste that is attributed to menstrual hygiene. And then next slide. This is really the summary of really the disposal of menstrual products. Ideally, culturally appropriate, discrete, and safe solid waste management systems. They will increase dignity for menstruating women. They will increase safety for formal and informal workers, and they will increase the functionality and longevity of the sanitation system. Thank you. Oh, and there's the final side of acknowledgements. In particular, I wanted to acknowledge a collaborating partner who passed last year, Professor Chris Buckley. He was a real champion of sanitation and also menstrual hygiene. So thank you, everyone.
Thanks so much, Robin, for that rich presentation. So much detail that we could spend a lot more time on. I know there'll be interest in some of the costing and other things that you've brought up, and a lot of overlap and interchange with what Miles presented.
Yes, thank you.
And I'm happy to present Dr. Shamila Mani, who has had a long history, including with the National Institute of Urban Affairs in India. And we are so happy to have you, Dr. Mani. I know time is really running, so we hope that you can focus on those slides that have not been spoken to already. You have about 8 minutes for this part, and then we need to bring in Julie Berra, one of our panelists, because she will be here for only 15 minutes. So I'll give you a flag if we need to take a break and maybe come back to your presentation. Thanks so much, Dr. Mani.
Thank you so much. At the outset, I'd like to thank RHSC for having me here. So I'm just going to bring to, just to highlight that, what is the size of the problem in India, and it has been spoken before. So I'm not just overemphasizing, but, just the fact that there's a huge amount of waste from menstrual waste and hygiene products that India is faced with. And this is already known that it has a massive impact on the environment and the communities. And also the fact that there has been a vocal demand from the communities that the manufacturers of the sanitary napkins should make it more sustainable, and also if it's really, when they say disposable, really make it in a sustainable way that it can actually be disposed or composted, or they should bring about the actual technological change if that is not there in the current situation. We just looked at some of the international experiences, and yes, many of the countries have either notified it as regulated waste or as medical waste, and therefore they recommend incineration or taking it to a facility where it can actually be dealt with. And in India, we have solid waste management rules 2016, and we have several other rules pertaining to biomedical waste and hazardous waste. But the rule 2 in the solid waste rule says that it applies everywhere, but it doesn't, it says also that it excludes the other rules and waste which comes under other rules, like the hazardous waste or the biomedical waste or the electronic waste and such others. So whatever is there in the solid waste management rules does not fall into the biomedical waste and or the hazardous waste. And there is a definition in the solid waste rules which clearly says that sanitary waste is a part of solid waste. And as you can see here, the biomedical waste management and its application is excluded when it talks about what can be done with the solid waste generated in domestic areas, which includes residential areas, commercial areas, as well as educational institutions and offices. So again, when you look at the various definitions, it comes even in the portions where it says about what comprises the sanitary waste. So you can make out that they're not making any mistakes. They are talking about the hygiene products. And when it talks about segregation, it says that it needs to be segregated. It also says that, the duties or responsibilities of local authorities, it says that you should provide personal protective equipment for those who are collecting the waste. And it also says that you should wrap it securely and mark it and put it into pouches which have been provided to you by brand owners, which we haven't. And I don't know if they are, whether actually people are able to do that. But again, it says that it should be put in the bin, which is meant for non-biodegradable waste. So just to clarify, the solid waste rules, they say that there are 3 categories. One is the biodegradable or the compostable waste, which is mostly kitchen waste and garden waste. And the second one is the non-biodegradable waste, which is meant for recycling. And some non-recyclable, non-biodegradable waste can go for energy generation. And the third one says domestic hazardous waste. So even when you check the definitions and you look into what is domestic hazardous waste, it does not include sanitary waste. It includes certain biomedical waste, and it includes mostly chemicals like cleaning agents and paints and pesticides, but it doesn't include sanitary waste. So sanitary waste is supposed to be put along with the non-biodegradable waste, but it doesn't say what needs to be done with it. Like I said here, it is supposed to be put along with the non-biodegradable waste. It says very clearly that domestic hazardous waste has to be dealt with in this particular way. And then there is a terminology called residual waste, and it says that you should give it to the particular agency to deal with it. And that is the municipality or the municipal corporation, and they will give it to those facilities which deal with the domestic hazardous waste. So as I said, there is a reference to sanitary waste, and it also says that the duty of the brand owners is to provide a pouch. Then you put it in the pouch, but then it doesn't say where the pouch goes, what is supposed to be done with it, or how it's supposed to be dealt with. So as I said, all the people who are managing the the sanitary waste have are up against a huge amount of waste, and that is normally only going to the landfill. Because what we found was, what they meant by saying the residual waste will go to the agency and the agency will take care. In the Schedule 1 and 2, it appears that they are only talking about sanitary landfills. And in India, there are hardly any sanitary landfills, so to say. There are very few. Most of them are dump sites, and which means that this is just going there, or it's burnt in the open. So there is a huge occupational hazard to those who are collecting it, who are transporting it, who are even putting it in the landfills, and also those who have to go up these mountains of waste every day to dispose these waste. So what are the alternatives? Because there are several organizations which are working on menstrual hygiene in India. And we find that there are many agencies which have come up with fairly reasonably good reusable alternatives like cloth pads. And also they have shown how the washing can be done. But this is really more applicable to the middle income and the high income group, because we still find that in low income areas, because of the communal tap, there is hardly any washing that happens because of my previous speakers have already talked about the shyness and also the taboo that women face while they are doing this, and also for drying it. So I would like to acknowledge the Saki project of the R. Nisarg Foundation and Dr. Lata Ghanshyamnani, who has shared these photographs. So these are some of the reusable products, like of course the cloth napkins and the cup, menstrual cup, and there are also, of course, the single-use disposable products, which are being used in some places. And I can only say that the penetration of these products is, one can say, to a small extent, because just now, even though many people have started to use, many women have started to use menstrual products or hygiene products, it's very limited I mean, these kind of reusable products or compostable or sustainable products are very limited in this. The table also, I would like to acknowledge the Saki project. And as you can see here, in the disposable sanitary products, like it has already been mentioned, the super absorbent polymer and the polyethylene and the various other products, which, even spun lace, which can either cause rashes or complete non-biodegradability and swelling and causing the clogging that was shown very well by my previous speakers. And as you can see here, that a lot of it is indicated for treatment by incineration and some by deep burial, but we are not very sure how much the deep burial is really working, or is it just like out of sight, out of mind type of a management, which is suggested. So even among the reusable products, as you can see, some are cotton, but there is some amount of polymer and polyurethane and other material. And again, they become liable to be incinerated rather than composted. So during the COVID times, I worked with the community in Gurugram, and we studied the the solid waste management rules, and therefore we decided that this was one of the ways to do it, that we could have a category for domestic biomedical waste in which we also put the sanitary products. And because when I was in the committee for biomedical waste and for solid waste, I try to emphasize, but what happens is most of these rule committees are being headed by administrative officers, and they try to reduce the load on other administrative officers who function as commissioners in various municipalities and municipal corporations. And therefore, they try to always, even when they listen to you, they are the ones who finally write it down in the rules. And so they avoid mentioning. So one of the things was that we can send it to the common biomedical waste facilities. And this actually happened in the COVID times, because in COVID times, municipalities and municipal corporations had to organize even door-to-door pickup or from communities or from RWAs, and they had to send it to the common biomedical waste facilities or substitute it with a hazardous waste facility nearby, as was done in Thane. So in Gurugram, it was actually had to be sent to a common biomedical. So it is actually possible, but they did not write it during the 2016 rules just to avoid the extra effort by municipalities. In Bengaluru, Hasirudala and various other organizations like Sahas have been working. And what they do is, as per the rules, they do collect it separately. And through the DWCC, they are negotiating with the common biomedical waste facility. And the municipal corporation has been has been cooperative and has enabled the various NGOs to send this to the common biomedical waste facilities, especially when it's a very big city.
Dr. Mani, you have about 1 minute left of your presentation. Thank you.
Yeah, so the absorbent core and the gel, which I said, and these are the things, which basically do not degrade. And this is the reason why it needs to go for incineration in the first place. And therefore it becomes a burning issue. And that's the reason why you find that, small incinerators. So in the case of Indore, which is cited as an example in Swachh Bharat, there is the common biomedical waste facility operator who takes all the biomedical and the sanitary waste, because that is available in Indore. But in a city right next to it in Ujjain, that is not available. And we found that very unsustainable incinerators were being operated in the common facility. So here you can see that there is a certain amount of experimentation that's going on in the National Environmental Engineering Research Institute, NEERI in Nagpur. And we are hoping that, they will be able to come up with a common incinerator, which can be put in a municipal facility, a municipal waste treatment facility, which is what is being mentioned in the rules, but there is no example, or it doesn't say what technology. We are hoping that this will happen. And also the fact that, through the Swachh Bharat mission and various other kind of schemes where, even the liquid waste management is also being dealt with, and the clogging that is happening in sewers. We are hoping that this would reach ultimately the common facilities. And of course, there are these management issues, which I've already spoken about, that the extended producer responsibility is not really being managed by the manufacturers. And therefore, there are also some experimentation going on for recycling, which is, some organizations which have said that even recycle it, but we really have to look at it. The Central Pollution Control Board has to approve it. And these are also seen in some of the toilets. In the rural areas, we are hoping that, we'll finally come to this kind of a thing where common municipal waste facility will also have a treatment facility. And also there will be more number of actually compostable pads, which can actually be composted in a easy way and not really go for incineration. And
thank you so much, Dr. Mani. I think we're going to have to stop there. There's so much. Oh my goodness, you just finished. That's great. So much rich information here, and I hope we'll have a chance to get back to some of it in our question time. Julie Berra, welcome. Thanks for joining. We know you just have a very limited time here. I wish we had a lot longer for this discussion, because there's so much great information being shared. But taking advantage of you being here, Julie is the coordinator of the Global WASH Cluster at UNICEF. And we're happy you could join. Do you have time for 3 or 4 questions, Julie?
Yeah, I have my colleagues, because we're supposed to start. Yeah, just go ahead and I will let you know if when I need to jump out.
Great. So given your work within the humanitarian context, what kind of impact do you see improper menstrual waste management having on water and sanitation systems?
So yeah, hi everyone. So I'm the deputy coordinator of the Global WASH Cluster, not the coordinator, That's Monica Ramos. So I just want to make that clear. Yeah, no, so I've worked in many different contexts, in war zone camps, IDP camps, refugee, and also, disasters and epidemics. So, and solid waste has always been a very big issue, but especially when it comes to improper menstrual waste management. So what I've seen really, especially was in Syria, we had women, they didn't know what to do with their pads because they wouldn't put it in the bin because that's their fluid and that doesn't go to a regular bin. If someone passes in front of it, that person could curse the person through the fluid, So we have those beliefs that we are not aware of as humanitarian aid worker internationals. We're like, yeah, I put a bin there and they're gonna throw it there. No, they didn't. So they would wake up at night, collect them and throw them over the fence, over the wall when nobody could see them. And I was, of course, you can imagine all the troubles with the neighboring communities, with even the safe security of the women. So that's always been very, very challenging in the field, indeed. Yeah, and without proper solid waste system in place already, even if, culturally women would actually dispose of their menstrual waste in a bin, if there's no proper solid waste disposal system, that's not going to happen. And very often, this is really like the aspect of sanitation that's sort of not really taken care of. We do water well, we do latrines, toilets, wastewater systems, fecal sludge management, even we do hygiene promotion, etc. But solid waste is really, the one that's often left alone. And then most of the time it's maybe because it's not a major concern in the country where people work in, but it hasn't been through all the way. Like I think with the Syria crisis and all the middle income crisis that we had, the Cox's Bazar crisis where space was an issue and solid waste became very, very critical, especially because they also caused diseases like leishmaniasis in northern Syria, as like sandflies who cause leishmaniasis would breed in solid waste. So all in a sudden we had to worry about solid waste 10 years ago, and we were like, oh my God, how do we do this? And at scale, because we know how to do a small refuse pit for a household or a village, but at scale, how do we really manage solid waste and menstrual waste as well?
That's gives us a good sense of the challenges, Julie. I wonder if you can describe what makes it so challenging to provide a functioning solid waste management system in these contexts.
So, if it's at scale, right? Because, if it's community or household managed, it's in every WASH book. But when you have a large camp or a large community with no solid waste systems, like we had in, thinking of Lebanon, in the Syrian refugees there, there was a solid waste system in Lebanon, but not for the size of the refugee influx. That couldn't be dealt with. So the problem with solid waste is that it needs it's a full value chain, right? So you need to have system for collection. Not a value chain, a process. You need collection systems, so bins, dumpsters that can actually contain all the waste, so that there's no open waste or waste in the open. Then we need trucks, compactors, and that's costly. It needs maintenance and skilled drivers. And then, so that to transport the waste, as our participant explained earlier. And then we need to either reduce the waste or treat it and then dispose of it. Incinerators are not easy they're expensive, they're not easy to operate and maintain. You need to have the parts in the countries. Often we don't even have them in countries, they need to be imported. But as every imported good, where are the spare parts and the maintenance and the operators? And then you need a sanitary landfill to dispose of the waste. We can't just throw waste, do wild dumping, which is widely done in countries where we work. But that's not proper, and I don't think humanitarian communities should promote that kind of use. But sometimes we don't have a choice because a sanitary landfill is extremely expensive. It's regulated. It needs authorization from the government. So it's really not a simple solution because it comes with a scale and it impacts the environment. It impacts the local authorities. Often the municipalities are in charge of the collection. So it's very complex. And on top of that, we also need to add some behavioral change for people to actually throw their waste where it should be thrown and not do what they've, probably used to be doing, just throwing it outside. If there's no, let's say, awareness, that was part of their background. So that's very difficult to change that mindset in an emergency where people are in very unstable context and have other worries, then, oh, now I have to throw this here. So this is very difficult. Behavioral change is one of the greatest challenge when it comes to solid waste as well. And that goes with menstrual hygiene too. It's part of the package.
Yes, it's a complex issue. You really identify some of these critical pieces that really speak to the global, lack of focus on waste management in general. And then you add all the complications of humanitarian settings. It's a huge challenge. So maybe one more question. The humanitarian response requires a collective effort between UN agencies, NGOs, implementing partners, and governments across different sectors. Given the complexity of the stakeholders involved, who should own and be engaged in the implementation of menstrual waste management? And should this differ at different phases of humanitarian response? And yeah,
that's a very good one. And I had this conversation with Adrienne a couple of times. I mean, MHM, or menstrual hygiene management, is really everyone's business. I mean, it involves reproductive health actors, implementation partners. I mean, all the reproductive health factors across the humanitarian board, WASH actors as well. I mean, I'm a WASH person, of course, so I speak of that best probably, but because they need to wash their hands, they need to wash their body when they change. So, if you put a hand washing basin that it's outside of the toilet door, or like the stall, nobody likes to go out of that stall with dirty hands and wash in front of everyone. So very important that WASH is actually understanding those concerns. Hygiene, of course, for the provision of the pads and the awareness raising around it for boys and girls and men and women, not only female. Sanitation for solid waste, we mentioned it. And also the infrastructures in WASH, they need to ensure privacy and room for changing. And like I said, water to wash. But also it also involves protection actors, education, reproductive health education and sexual education, when culturally acceptable, could be part of our hygiene promotion package, but also of education package. And it also involves the cash working groups in general, or cash sector, if that's a sector, because that's really a good means to give women opportunities to choose their menstrual product. So actually, it's really everyone's business. And I think all should be involved from the start, and not, you do this at this phase and you do that at the other phase. I think we should all work collectively. Eventually, interventions will be heavier on cash when it's the time for distributing the pads or the material to the beneficiaries. But I really think I really think that we should all be together working on this, and not having necessarily different phases, or at least I haven't been in other than emergency phases. So I wished and never had the chance to have everybody or every stakeholder on board at that time. But I really hope that it's going to change.
Yes, I think that's a great point, that it does cross all these different sectors, and it really needs the voice of everyone to be effectively dealt with. Thank you so much, Julie, for jumping on.
My pleasure. Thanks for inviting me.
Short window you had. We appreciate your presence. And then I'd like to introduce another panelist, Nicole Klesner-Metzner, also with UNICEF, the South Asia Regional Office. So Nicole, welcome. And further to what Dr. Mani has shared, and based on your experience in developing country settings, what kind of guidance exists for the classification of menstrual waste?
Yeah, thank you so much for having me on as well. In preparation for today's webinar, I did look into some of those strategies, specifically for the countries that I'm supporting, which range from emergency settings to what we heard about a lot already today, India. And there was a shocking lack of policies to start with. There's a shocking lack of guidance. I think the most classifications that I could find, and that some of my colleagues also kind of interact with on a more regular basis, is that menstrual waste is classified as solid waste, in some cases as medical waste, but in most cases there is just no guidance. There is no clear policy available. It is kind of a bit of a gray area, and in that regard, menstrual hygiene strategies, as much as they exist, do have a wide-ranging differences. How detailed do they manage the issue? For example, we supported the government of Bangladesh last year very strongly with the development of a national menstrual hygiene management strategy, and it goes into a very high level of details on how they imagine the disposal of menstrual waste. But one of the issues on that is that disposal is often an afterthought in those policy discussions. They are heavily engineering dominated when it comes to solid waste management, when it comes to the wash sector very often, but specifically when it comes to solid waste management, they're very often therefore exclusively male-led, which results in menstrual hygiene waste just not even being considered or being a little bit of an afterthought. And this leaves a lot of room for interpretation, kind of putting the responsibility for disposals on individuals versus establishing the enabling environment. Using the example of Bangladesh again, it was a very difficult discussion to have for us as UNICEF advocating for girls' and women's rights, and fighting the idea of some of our counterparts having designated menstrual health vans driving around villages and picking up used menstrual pads, which, you know, would even more stigmatize, would lead to increased costs. There is no sustainability in a system like this. And at the same time, it, for example, also wouldn't take into account innovations that are ongoing in the sector, where disposable pads are more and more made out of a large variety in terms of materials, and therefore shouldn't be treated as a homogeneous type of waste either. There is composting. I mean, so many of the technical options and thoughts were already mentioned in the presentations and today. So it is very, very clearly a gray zone that we're dealing with currently. And I think in the second presentations, we heard it very, very clear. There are female planners needed that think this through from A to Z. And disposal cannot be an afterthought, which unfortunately it very often still is.
Yes, absolutely. That's a great reiteration of the importance of involving women in the planning process or menstruators to understand what the issues are and to really think through all the different steps. What do you think are the operational impacts of the improper classification of waste? How does that affect operations?
Improper classification obviously has huge impact on systems, on the enabling environment that would be built up through the policies that we're trying to support as UNICEF for governments building up. There are health effects, there are environmental impacts. We need to more and more take into account as well, obviously, a certain aspect of climate resilience. If we're looking into disposals and the numbers that were mentioned, for example, by Dr. Mani, and looking into a country like India with a vast amount of menstruators. This is a long-term sustainability issue that through the wrong classification can have wide-ranging impacts. Through targeted and really nuanced classification, I think is the way to go, is what we're trying to enable governments to take informed decisions off as UNICEF and with our implementing partners. Just another example again, if you're looking at menstrual waste being classified as hazardous materials, and then you're looking at schools that are struggling with budgets for the implementation of wash in school activities in general, that are struggling to get clean water into the schools, have the budget available for soap, and then we're burdening them on top of that with a inappropriate classification of waste, which leads to increased costs, increased efforts. So I really, again, liked the presentation that was given earlier, and putting more of the of the focus, instead of classification of the actual waste, on the safe handling of the waste. So I think that the first presentation today really set a very good overview of those nuances. And often the policies that do exist do not take those nuances quite into account yet. So this is something where we need to look into, ultra poor parts of a population, looking from a leave no one behind angle, looking into institutions, schools, healthcare facilities. That, I mean, we know how much problems we have with healthcare waste management, and then classifying something higher up the waste chain basically than necessary can just lead to a lot of unnecessary burden on those providers.
Thank you so much, Nicole, for sharing that perspective. It's well received, and I know Marnie Summer was on this call earlier and asked a question about how we can advocate for some of the really important points that you all are raising, Dr. Mani and Robin and Miles and Julie and yourself already. And I think that's a great question for us to take away from here, or how can we turn this into advocacy to improve some of these big challenges. And with that, I'm going to move to our last but not least at all panelist, Joseph Gitinji, who is the General Manager of Operations for Sanergy. Joseph, welcome, and thanks so much for joining us on this webinar. We only have 9 minutes left for the whole thing, and I think we want to share the final poll results. So this will have to be very succinct. But I wonder if you can, and Sanergy, I should say, is a Kenyan-based company that provides safe sanitation facilities to urban slum dwellers in Nairobi and Kisumu. Could you share a little bit about Sanergy's model and the different approaches used to drive segregation at the point of disposal?
Thanks for having me, and glad to add my voice as from a practitioner's perspective in as far as disposal of waste. So Sanergy, as you said, is involved in sanitation, and so we offer what we call container-based sanitation, which is a form of the non-seaward sanitation. And our goal is working with communities in the urban informal settlements in terms of waste management. So addressing the whole value chain, say from containment and emptying to the transportation of that waste out of the community, to treatment, and then we go a step further to reuse of that waste, more of producing agricultural inputs, mainly in terms of organic fertilizer, as well as insect-based animal feed. In terms of our model, so ours is a dry toilet, so there's a separation of urine and feces, and that is contained separately and also removed separately. And then we also add in a component of hand washing as part of wash to make sure that we are providing safe sanitation. The other aspect specific to menstrual hygiene management is the whole aspect of containing that waste. So the way we do that is providing a clearly labeled and lined waste bin that is provided within the facility, where then any of these products then can be safely disposed, and then that is also removed as part of the integrated waste management system. So in a way, we have integrated MHM as part of our waste management process for sanitation, and we're able to then address that from that perspective.
That's great, great background. So can you speak to why it's so important to separate solid waste, including menstrual products, from the urine and the feces that you collect?
Right. So separation is key for us, especially looking at the way we address sanitation waste. Our goal is to make sure that we are able to safely contain the waste, as well as not just treat, but also extract the useful byproducts that we can be able to plow back into the economy. So I talked about agricultural inputs, mainly in terms of organic fertilizer and the insect-based animal feed. So separation plays a key part, because then you want to make sure that the waste that you are capturing is properly organized in a way that can allow ease of management in terms of transportation, as well as the treatment of the same. So if you're looking at separation, for example, it's important to identify what are the waste streams that are that you are capturing, and then be able to put in that into the various places so that it's easy to transport. As I said, in terms of MHM, we have actually provided specific bins where users can actually be able to dispose that, and then now facilitation is done in terms of removing of that waste. The other aspect that I would want to highlight is the whole aspect of dignity, especially for women and girls. I think Miles did talk about stigma that's associated with MHM. And I think for us, the fact that we are able to provide a safe facility where women and girls can actually be able to use for sanitation, but also go further and provide a safe disposal place for MHM products. That's something that we have seen from the feedback that we've gotten from our users, that really speaks a lot in terms of just restoring their dignity as women and girls. And it's something that they value as part of what we offer in sanitation provision within the urban informal settlements.
That's such an important point, really important. I'm so glad you said that, the dignity of women and girls and all menstruators. And that really, I think, runs through all of this, that systems will not be used. I mean, I think Julie was speaking to this in the emergency settings, but systems will not be used if people don't feel safe, and respected in what's being provided. So the voice of the menstruator is so key. So how does the company deal with the disposed menstrual products with regard to collection and processing, especially engaging with the sanitation workers?
Yeah, so a great question. And I would want to kind of approach that from stepping up back a little bit from the point of engaging with the community or the users in this case. And so we've done a lot of work in terms of user education and training. Number one, because the kind of sanitation facility that you provide is a dry toilet that does not use water. So that means then we have to do a lot of education so that the users know how to use this facility. And coupled with that is the safe disposal of the different streams of waste. So for example, it's not just a question of providing the waste bin for MHM products, but it's also a question of educating them on why that's important for those products be disposed in that way, and also where to dispose them when they get to using our facilities. And then the other aspect is also around our workers. So we have a team of workers that are also involved in the collection of that waste. And what we've done in terms of protection is provide them with proper PPE. So you're talking about gloves, masks, coveralls, as well as boots, so that then they are able to safely collect and manage that waste without getting contaminated. And then also we do provide inoculations regularly, just to make sure that they are protected in as far as handling of waste is concerned. So not just looking at the containment of the waste, but also the people involved within that value chain of the management of that waste.
That's really helpful. That was sort of the last question about the safety of menstrual waste with regard to blood waste and the risk to sanitation workers. Is there anything else you'd want to add to that?
Yeah, just to mention also, as I said earlier, that so for us, the issue of black water maybe not a big one, because ours is a dry toilet. So there's no mixing of blood with water. But also important that we are also able to provide the hand washing component, which is key as far as sanitation is concerned, ensuring that people do not only have access to a sanitation facility, but they also have access to a place where they can actually wash their hands as part of the hygiene provision.
Great. Thank you so much, Joseph. And thank you to all presenters and to all panelists. This has been really, really rich. I only wish we had more time to go in depth because there's so much great information here. But it's clear that there's a priority that needs to be given to this area. And it actually speaks to the entire solid waste management system. I feel like the lack of priority of that aspect of our public health is really apparent in these conversations, but especially with a sort of sensitive product like menstrual products, that we need to find better solutions. We need to involve women. We need to look at the policies, as Dr. Mani and others have said, that are so unclear, that even if they're there, they're not specific enough. And we need to really look at what are the basics for safe handling of waste to protect those who are actually frontline workers and the menstruators who are in the communities in these areas, so that we're not providing them with solutions that are dangerous for their health and well-being. So thank you all for joining this. We know there are many more people who were not able to join, and there will be a recording of this that goes out. We really appreciate your staying here and participating. The questions that have been asked, I believe that some of these will be addressed in some of the reports that we can share, because there's obviously a lot of background here that is of great interest to people. Thank you again for joining, and stay tuned for the last in this series of webinars, which will actually address some of the innovations that were alluded to today. So we'll go into that sometime likely next month. All right, thank you. Have a good
Thank you, everyone. Yeah, thank you.
Thank you so much.